issue, it was not allowed sometimes to go outside. So I thought to myself, if I can't go outside, I go inside. And going inside is, for example, such an easy exercise, closing your eyes, observing your breathing, and counting down from 3 to 1 every time you breathe out. Okay. Graciela, you would the next slide, please, or can I do it? Yes, okay, yeah. As Daniela said before, some words about me, for what I'm here and what is my special competency talking about the issue as Corona. I'm a psychologist and also banker, so it's a interesting constellation. I wrote my PhD dissertation in Tübingen at the university about a specific phobia. A specific phobia is a phobia focused on one issue. For example, I have a client who is anxious about driving in a car. This is a specific phobia. Or I had a professor many years ago who was anxious for flying in an airplane. Also specific phobia is a phobia that is focused on one issue. I teach at the university in Tübingen every 2 or 3 semesters. And one year before, I had my first teaching at the MIUC in Marbella. So coaching and dealing with anxieties and, for instance, dealing with stress is an issue which is very, very important for me. I worked for more than 25 years in different contexts. In a single context, in my practice in Tübingen, where I work with people with burnout, with anxieties or conflicts. Then in the context of groups, on the background of my banker education, I often work in banks with leaders, and Joachim Frick, who joined before, is one of my loyal customers and a good friend of mine. And so I'm very lucky that he is here on this evening. And the third context is public. I have 2 TV programs or two sessions in German TV about stress and how to deal with stress, and although how to become more successful. Okay, so my context and special for me is I have a special attitude. This is the attitude of NLP. NLP is neuro-linguistic programming, and hypnotherapy is some sort of hypnosis, but it's the good hypnosis and not Daniela, is it okay for my speed?
Doing what you can.
I'm too fast?
No, it's just let me see. Was ist das mit der Neuro? If you tell me.
Neurolinguistisches Programmieren, NLP.
Para aquellos que acaban de entrar, tenéis que ir abajo donde dice chat y a la derecha vais a ver una franja donde Daniela está haciendo las traducciones.
Okay, puede.
Ja. Daniela, stopp mich bitte, wenn es zu schnell ist. Gell?
Entschuldigung. Porque esto es un poco, espérate, neurolinguistische
Programmieren, NLP. Warte, ich schreibe es mal rein.
No.
Geht selber? Ja, okay. Gut, okay. The next slide, Graciela, por favor. Yeah, okay. COVID and the effects of COVID. How does COVID and the restrictions about COVID influence our mindset? I think this is a very, very special and important issue. First, the attitude. My issue is how to get a special attitude against Corona is not the solution. It's for me one part of the solution. The solution must be a political solution. And we have a very large range between there's no COVID at all, it's just influenza, up to we have in some parts of German, or some scientifics in German says the goal must be a zero COVID. So we can see it's a large range. My issue is to give you some impulse how to get another attitude, because the attitude is the most important thing. Everything what happens in your life is just an event, and the most important factor is how to deal with this event. And I think COVID influences generators in most of us phobias. I talked about specific phobias before. And a phobia is an interesting phenomenon because phobias are first in our mindset. It's first a visualization, it's an idea, it's a thought. And interesting, these thoughts became some sort of reality and leads to a lot of avoidance behavior. I do an example. I have a client who is a Catholic priest, and he has fear of driving in his car to his church services. So he needs 50 minutes to the church, but he has so much fear of driving in his car, so he has to go by feet and he needs 1 hour. So a phobia is first in our mind, but has special effects in our behavior. And the effect of a phobia is on different levels. Thinking, then our emotions. And the special thing is thinking influences our emotions, and our emotions influence thinking. It's in the issue of phobias, some sort, we say in German, it's a devil circle, a Teufelskreis, a devil circle, because you think anxious about going outside in Corona times. Maybe you want to go to buy some groceries, and then you have special fears in your, and the fears, the thoughtful, the panic thoughts leads to a special feeling, and this feeling generates the next panic thoughts. So it's important to, if it's possible, to stop these panic thoughts. One intervention some people can help is say to yourself, say to your inner voice, stop. Stop is enough. It's enough. Normally you have to say it several times, stop, so you can interrupt the devil circle. Thank you, Daniela. Near the effects in our thoughts and our emotions, we have a lot of effects in our body. I think everybody knows the experience having fear. So as a little child in the darkness, the heart beats faster and the breathing is a lot more narrow, and the hands, the palms are getting more wet. So interesting, thoughts influences our body, up to some body diseases. So phobia is a little thing in our head, but has lots of influences in our mindset, in body, in emotion, and also in our thoughts. And it leads to avoidance. So I don't trust to go outside. This is a difficult thing. On the one hand, it's okay to stay at home. On the other hand, it's some sort of restriction I gave to myself. And normally the restrictions are getting more and more. So this is a little devil thing. Phobias normally is good in the frame of phobias to confront with the phobia, doing a little exercise. So today I was able to go 100 meters to the supermarket. Tomorrow I go 115 meters to the supermarket. It's sometimes real hard stuff. Doing therapies, but step by step, it is possible. So better not to avoid a behavior because of Corona. And in this context, I think the three issues in Germany we have, I think it's in Spain, the same mask and washing hands and physical distance is one success factor. It's no question. But we can also, with our minds, I will talk later a little bit, we can also protect us with our mindset. But first I have to understand what's going on in my mind. So these are the direct influences, phobia and avoidance, and the indirect influence on our mindset is the restriction that it's not allowed to go outside after 8 o'clock in the night, for instance. These restrictions are for adult person a lot of, yes, it's a really challenge. We are all adult persons and the government says, wow, Horst is not allowed that you go outside after 8 o'clock in the night. So it's a critical issue, and one person reacts with aggression. So I don't care what the government says, I don't care what the policeman says, I go outside. Aggression. Other persons react with a depression or having no energy, feeling helpfulness, having a issue of lost control. So it's in different regions. The solution for phobia is being so encouraged to confront. And if you react with aggressions, then it's helpful to interact the aggressions not with other persons, but maybe in sports or in boxing or something like that. Because the aggressions in families, for instance, aggressions against a little child, some German and some issue in some regions, issue is very bad. And if you react more with the depression, then you can ask yourself what is necessary, which inner voice has to be more in my mindset, that I'm able to be more agile and more active. Thoughts, creating some sort of reality, and our reality in our minds influences a special behavior. So you can see the point, focusing on your thoughts is very, very important with phobias, and for instance, although with the COVID phobia. Okay, comments or questions up to now? Okay, so Graciela, I see from your
perfect.
Yes, okay, nice.
¿Estáis siguiéndolo los que hablan español?
Pardon?
I'm asking in Spanish now. Just, Luis, Bueno, Luis es difícil de seguir.
No.
JJ, ¿puedes seguirlo?
Yo
Sí.
sí.
A ver, que yo estoy intentando traducirlo lo más literalmente posible, pero no es tan fácil, ¿eh?
Lo que puedas.
Se le entiende,
Yo le
habla
dije
muy...
que
Lo
habla
que
muy
puedas.
habla
Yo
muy
creo
bien.
que lo estás haciendo maravilloso.
del alemán, pero bueno,
Habla muy claro y muy despacio.
espero que se pueda entender.
Se lo hemos pedido especialmente que hable despacio.
Sí,
Okay.
sí, perfecto.
Okay.
Ok,
Great. The
sigamos.
next slide, please.
¿Alguien quiere hacerle alguna pregunta? ¿Hasta aquí? No. Yeah, so go ahead. Go ahead.
Una pregunta. Para la fobia es no tan fácil, depende del carácter de la personalidad. Si
Sí.
es una personalidad firme que sabe el sentido de vida, es más fácil que una persona que ya tiene problemas para vivir. ¿Y cómo se puede ayudar si la voluntad no es tan fuerte para parar la fobia?
Se lo traduce Dani. Dani.
Estaba yo ahora mismo, perdón, estaba
bueno.
estaba yo
What
ahora.
he's saying is that when someone has
Yeah.
a very strong character,
Yeah,
kind of
what I understand, Hans-Dieter, is you say it's a question of character, of personality structure. Yes, yeah, sure. Some persons are shy, some persons has more fear from childhood or something like that. And yes, absolutely a question of personality. But I think we can learn to get more confidence and more self-assertiveness. I think it's somehow to learn. Yeah. Okay. Graciela, next slide, or is this difficult?
Oh, no problem.
No problem. So it's yes, okay. So it's easier to follow my words. Okay. Now the special question: how can we overcome these challenges to COVID? I have 3 interventions for you: reflecting, the issue behind, and tapping. First, when a person is anxiety about Corona, he has a special feeling in his stomach, in his heart, and he's not clear. He's suffering. First, he's suffering and he's avoiding. And if we succeed getting in a position to observe ourselves, when we get into a position to observe ourselves by special questions, then it's of help. So one question could be, which concrete fear for what mostly when you feel an unspecific feeling in your stomach? What is the specific fear? In the morning, you want to go outside and you have a bad feeling. What is the specific fear? Is it a fear of getting to death, or is it a fear to getting infected, or is it a fear to infect other persons then? And how much is the fear on a scale from 1 to 10? It's not a question of right or wrong, but scaling helps getting more in a distance to our phobia. Scaling helps to get more in distance to our phobia. So maybe one person has had this morning a phobia of 0.6, so it can be in the evening 0.3, or vice versa. So I think it's important to have these observation position to ourselves. And this leads to a little less phobia. Then getting in contact is not dying. This is my favorite challenge. We all have a human system. We all have a human system that is our friend from our first breathing. Getting to this world, the first breathing, our human system is still active. And coronavirus, we have the last years a lot. We don't have SARS-CoV-2, but coronavirus we have every time. And our human system is very perfect in dealing with viruses. So I think it's part of our living to deal with viruses. And to clear it up, when I fear going outside, that going outside is not getting death could be of help. Because you have a human system, you have your mask, you have your distancing. And although people who are, I think, over the 80s, it's not the probability is higher that you have more side effects, but getting in contact is not dying. So then second question that would be of help, which resource can be of help? Resource with which competency in yourself? It's a very interesting issue. We have in some contexts resources, and in the other context we have no resources. Or on one day we are feeling encouraged, on the other day every courage is away. But we can reflect, we can remember the living, how it is when I'm feeling better. So we can reactivate resources, competencies, good training. So if you are in a situation not being tough enough to go outside, then you can say, okay, which resources in myself I have to activate? The resource of courage is a resource of being strong. This is a resource of being a hero, and reflect in your past. You had a lot of resources. That can help you also on the issue of COVID. And in this context, this could be very interesting to reflect what is the worst case fantasy. What is the worst case fantasy if you go outside? To reflect. People have so many different issues in coronaphobia. We don't have to fear about the virus. A virus is invisible. A virus is very small. It's not. It makes no sense having fear of the virus itself. We have fear about the consequences. The consequences is our mindset. And I think it's important to clarify a little bit what is the fear I have. I have some clients. The biggest fear for them is not being infected, but infect other persons. For themselves, they say, "Oh my God, so I have COVID, but I don't want to infect other persons. I don't want to infect my grandmother. I don't want to infect my grandfather." So you can clear up what is my greatest fear? What is the worst case scenario? And how realistic is my worst case scenario in probability scaled on a scale from 1 to 100? How realistic is my worst case scenario? Why? I heard you had in in Marbella the last days or last weeks a incident of 1,000 to 100,000 people. This is the number. Yes, but if you think rational about it, means every 100% is infected. Not everybody, every 100. So we are here in a chat of 72. No, this is the chat.
No, 16.
16. Yeah. Okay. Sorry. Yeah, was wrong direction. We have 16. So 16 is not 100. So in Germany, we have here in Tübingen, we have an incidence of 30 to 100,000. That's minimal. That don't is the message is not take it easy. I think it's always important to wear a mask or to help distance, but I think we need a special attitude. So 1,000 to 100,000 is a lot, but every 100%. So suppose you get in contact with this person, that does not mean that you were infected. I know persons, wife and a husband, the wife has a lot of corona and the husband lies in a bed, no COVID. Yeah. So getting in contact means not that I'm getting ill, and getting ill means not long. It's no issue of dying. So many people have COVID in Germany. They are ill. They are sick for 5 days with fever, and then it's getting better. What I heard about COVID is we have a lot of a few weeks ago. It takes time. Yeah. So how realistic is this issue? And from the medias, I'm not lucky about the communication in the medias, because always making fear, I can understand the intention behind, but for phobia is horrible. But if the government would say, take it easy, we have 1,000 to 100,000, so you are not getting sick. The fear is not about corona. The fear of the politicians is, from my point of view, that people would be easy. We don't have to wear a mask. Yeah. So anxiety is somehow, an instrument to lead persons. I think there are other ways for leading persons. Leading is for me more with purpose. For what are we doing? Wearing our mask. What is our issue? What is our goal? So the probability, I think, is a very important thing. And another question is, how about modifying our fantasies? When I talk to people in my practice and say, wow, okay, I understand you, but maybe you can think in another way, they say, oh yes, I would like to do it, but I can't. It's too heavy, it's too difficult for me to think in another direction. But what we can do is to change the structure of our thoughts. What we can do is to change the structure of our thoughts. So I want to invite you to a little exercise. You close your eyes. If it's for you, it's just a moment. It's just 1 minute. And please think about for a shortly time, think about a situation that makes you anxious. Just only a situation that makes you anxious. Maybe being confronted with a spin or something like that. Just think about this, and then if you think about this phobic stimulus, then you can change maybe the structure by making this picture more dark, or you make it from color to black and white, or you make it in a way that is more distance. from your inner eyes. Yeah, this is what I mean with we can strange the structure of our thoughts. It's a very interesting thing in NLP to exploring the structure of our thoughts, and it makes a difference whether I think with color pictures or with black and white pictures. It's a different whether I have an anxious voice in me or I have a voice that is, yes, full of calm and full of confidence. I know it's an issue, it's a challenge, but it's sometimes easier to change the structure than the contents. And next point, the issue behind. What is the issue behind of my coronaphobia? What is it? Is it about coming into a hospital and being helpfulness? Is it about dying? Is it about needing a breathing machine? I think we have a different issues behind a phobia. And also the fear of dying is for some people quite different. My mother died 5 years ago, and I asked her and I said, Mom, are you fear for dying? And she said, no, I have no fear for dying. No, I have no fear for dying. I had a so lucky life. And I know when I die, in the getting into the heaven, on the left side will stand my father, and on the right side will stand my mother and will say hello to me. What a nice picture. It touches me. It's so good. No fear, because she had a mindset that was positive. Her loved parents will welcome her in the heaven. My God. Yeah. So it's a question of our mindset, of our attitude. And the issue behind is sometimes really important. What is the issue behind a phobia? It's not the phobia. This is mostly getting helplessness, getting into connected with a breathing machine, getting in a state of not more able to breathe, something like that. And after this cognitive intervention, I want to show you a intervention that is very, very famous in German since a few years. This is tapping. Tapping. What does it mean? Tapping is very, very easy. For example, you have any situation of stress, COVID as a stress factor, or you are lying in your bed in night during the night, and you wake up and you can't get in sleep again. A lot of people are thinking about the future and COVID and oh my God. Much better is to tap. What does it mean? Tapping is a tapping mostly from your middle finger between your eye brushes. This is the first point. The second point is under your nose. Third point is under your underlips. And the fourth point here is sternum. And if you like, you can try it out. Take a stress situation. Maybe the next situation that is for you some sort of stress. Let's say this evening. Any situation where you feel a little bit tensioned. And then think of the situation and then tap between the eye brushes. You can do it for many seconds. Tap here between the eye brushes and feel the difference. And if you have the feeling that it's not getting better, then change to the point under the nose. And if you feel that it's not getting better, then change to the point under the underlips. And then sternum. So this is a very good way, tapping energetic points in your face to deal with not only corona phobia, with every phobia and with every stress you have in your life, especially in the night. I have a lot of clients, they say, wow, tapping in the night is so good because in the night you have a special issue that you and your panic thoughts are very, very great. In the day you have a lot of other thoughts, you have other people around you, but in the night you are confronted with yourself. So tapping.
Sorry, somebody, alguien tiene el sonido de afuera. Me parece que es Alfonso. 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 A ver ahora.
Graciela, te salí.
Vale, vale.
Sí, el moderador puede cerrar los micrófonos, ¿eh? Es decir,
Sí, sí, yo los he cerrado.
solamente el ponente.
Voy a hacer tapping porque estoy un poco estresada.
Tapping, yes. Okay, Daniel, is okay? Or any question? Is it
Era
okay?
Alfonso.
Okay, good.
Yo no
Yes.
sé si está bien para los que lo están leyendo, pero...
Ok. Gracias, Dani.
Yes. So the last slide, por favor. Graciela. Yes. So I want to invite you to a little relaxation and a visualization exercise. This is some sort of hypnosis, but not the show hypnosis. Hypnosis are different ways. Hypnosis, every mindset, every state of being focused is some sort of little hypnosis. And I think in a time where we have outside not enough safety, is very, very helpful finding inside of you, finding inside of us a room of safety, and also a room with a little faith and positive energy. I think it's difficult to find outside. For me, I cannot find it outside. If I read newspapers, if I go to internet, only the next horrible message. It's the mutation, the next horrible message. Oh my God. Yeah? So I think it's good to have the safety a little bit inside of us. So I want to invite you to the exit of my short speech. If it fits for you, to close your eyes again or to focus any points in your room. And as you remember, breathing can be...
Sorry, si hay que cerrar los ojos, voy a decirlo. Hay que cerrar los ojos, respirar.
She's translating word by word.
Augen kann sie nicht lesen.
Ach so, ja, klar, okay. Ja, klar. Ja, genau. Nee, dann übersetze ich spreche langsam, genau. Langsam zu sprechen, genau. First, to observe your breathing.
Hay que observar la respiración.
And maybe it is possible for you when you breathe out.
Cuando se expira,
maybe you can feel a little bit more comfortable or more quiet.
Tal vez se pueda encontrar un poco más cómodo.
And if it fits for you, you can ask to yourself.
Sí,
I'm
va
totally
bien
quiet.
preguntarse a sí mismo,
I'm totally quiet and relaxed.
estoy totalmente tranquilo y relajado.
And maybe you can imagine how it would feel if your right arm is heavy.
Imaginarse que tu brazo derecho pesa mucho.
And if you like, you can repeat it. My right arm is heavy.
Si queréis, podéis repetir, mi brazo derecho pesa mucho.
My right arm is so heavy.
Mi brazo derecho es tan pesado.
And I'm totally quiet and relaxed.
Y estoy totalmente tranquilo y relajado.
And also my left arm is heavy.
Y también mi brazo izquierdo pesa mucho.
My left arm is totally heavy and relaxed.
Mi brazo izquierdo es totalmente relajado y pesa mucho.
It's totally heavy and relaxed.
Totalmente pesado y relajado.
And maybe my right hand is warm.
Mi mano derecha está calentica.
My right hand is warm.
Mi mano derecha está caliente.
And also my left hand is warm.
Y también mi mano izquierda está caliente.
My left hand is warm.
Mi mano izquierda está caliente.
And now I want to invite you to remember any situation of feeling safe.
Hay que acordarse de una situación donde te encuentras muy seguro.
Maybe lying in your bath tube.
Tal vez en la bañera
Or watching sunset.
o viendo una puesta de sol.
Any situation, maybe before COVID, where you feel really safe.
Cualquier situación, tal vez ante COVID, donde uno se encuentra seguro.
And maybe you have now a picture that stands for the safety.
A lo mejor tenemos una imagen que representa la seguridad.
So this could be a little remember anchor for you.
Eso podría ser un ancla de recuerdo.
And now I want to invite you, I will do not speak a lot. I will make a break for around 20 seconds.
Va a hacer una pausa de unos 20 segundos
So you can enjoy it more.
para que cada uno pueda disfrutar de su imagen mental.
Okay, thank you. Now you can
Gracias.
come back in your own way by opening your eyes again, by stretching a little bit, by taking
Poder abrir los ojos, estirar el cuerpo.
Wow. Okay, maybe this picture you had now in your visualization could be a help for uncertainty and unsafety outside, because you have real safety inside of you.
Tal vez la imagen que hayamos tenido en ese momento en nuestra mente pueda ser, en momentos de estrés o de miedo, un refugio.
Yeah, the next slide, Graciela. Some informations. If you want more information about relaxation, about hypnosis, go into YouTube and go give my name in. You'll find a lot of videos. Or if you're interested in a special burnout issue, there's a special website, stress24-7.de, where you can get more information. Yes, so I want to say thank you for your attention. The last slide, Graciela. Yes, thank you. Thank you for your attention and also for your lifetime. So I'm very grateful that you share this nice evening with me, with my thoughts. And I want to close with a saying of Epictetus, is a Greek philosopher. He said, "It's not the events that worry us, but rather the attitudes we have towards those events." Thank you. And yeah, if you have questions, I'm here, you can ask. Thank you so much.
I think it was really interesting.
Thank you, Graciela.
Really interesting. Some of us might have some worries about COVID. I think mostly, especially of age, as far as I know. Digo que muchos de nosotros, por lo que yo he estado hablando con gente, la preocupación con el COVID está directamente relacionada con la edad.
Yeah. If you have questions to this issue, you can write me an email. I'm really happy. Sorry, I write it in the chat, so you can write me an email if you have questions.
Si alguien tiene preguntas, puede escribirle directamente a su email.
Yes.
¿Alguien tiene preguntas? Marite, dime.
May I thank you very much for your talk, very interesting. But something that I don't know, it is not a phobia, but what most of us are feeling because of COVID is the lack of kisses and embraces and
Yes.
really direct
Yes.
contact. So and this is not a phobia, and
No.
you will treat it the same way, or is it different kind of treatment you need for this lack of, because it hurts, it's something that really hurts.
Yes.
Pregunta, Ricardo, tú has no. Lo que pregunta Marité, dice que algunos de nosotros lo que más sentimos con el COVID es la falta de abrazos y, digamos, besos, la cercanía.
Yeah.
Pregunta si es una fobia.
Yeah. No, the treatment. The treatment maybe is some sort of remembering of feelings being embraced. It's not a good solution. It's only the second best, maybe the third best solution.
But that hurts a lot.
That hurts. Okay. Mm-hmm.
No?
Okay.
It's like having something in your tooth. No? Then you try to put your tongue, and it hurts, and it hurts, and it hurts much more.
Yeah, if you were aware of your leg, then it hurts more.
Mm-hmm. Exactly.
Yes. Yeah.
Dice, Marité hizo un ejemplo muy bonito, diciendo que era, porque no es una fobia, dice Horst, pero dice que esto es como, si a uno le duele un diente, poner la lengua en el diente duele más y más. Y es un poco lo que uno siente. How do you treat that? Yo le pregunto cómo lo tratas.
Yeah. In Germany, we would treat it very practically. We have here in Tübingen, especially, we have a large clinic here. Tübingen is a university city, and we have a lot of rapid tests. We will have the next 3 weeks in Tübingen maybe a normal life because of rapid tests. Rapid test means you get together with a person. Both persons are doing a rapid test. In 50 minutes, you get the results, and then you know the other is not infected, and I'm not infected.
Yo creo que también el problema de la falta de contacto, de abrazos y eso, aquí en el sur o en países de Latinoamérica es más acentuado por el carácter de la gente. Yo, por ejemplo, yo soy suiza. En Suiza se dice que están esperando a que se quiten las medidas de seguridad por el COVID, que son 2 metros de distancia, y poder volver a la distancia normal de 5 metros que teníamos antes. Ahora nos tenemos que acercar hasta 2 metros a la gente, y si antes estábamos a 5 metros.
Yeah, yeah.
Pero Horst decía recién.
Yeah, another possibility, Merit, could be being very close to an animal. Could be of help.
Dice,
I have a cat that embraces me.
dice que tiene un gato que lo abraza.
Really a good
Pero
feeling.
la otra, sorry,
Dogs or cats can be a very good partner. They can give you warmth and can give you presents.
pero dice,
Tanto toxoplasmosis.
¿cómo? No, la otra que decía es, en la clínica donde él está, se hacen test súper rápidos, se verifica que ninguna de las personas tiene COVID, ya se pueden abrazar con un test rápido.
Sí,
Yeah,
para
yeah.
un nivel de
And
sensibilidad en el caso.
I think that this in Germany, this will be the future. The plan is for everybody in German a rapid test.
Dice
So
que
you
el plan en Alemania son los test rápidos.
Yeah. And fortunately, we have a major here in Tübingen who's very active in this issue. And so I hope that life could go on normally, but with rapid tests. You have to do, if you go to a supermarket, you have to do a rapid test. You have to wait 50 minutes and then you get your budget and then you can go in. It's not good, but the life can go on and not always lockdown and lockdown and lockdown, the next lockdown, and then the numbers are increasing and the next lockdown, there's no life.
Dice que en realidad la idea es que se haga, por ejemplo, en Alemania en la puerta de los supermercados y evitar así los cierres perimetrales o los lockdown, ¿cómo se dice lockdown?
Los confinamientos.
Confinamientos, porque si no vamos a estar de confinamiento en confinamiento. Y lo que piensan en Alemania es usar esos test rápidos para resolverlo.
Yeah, yeah. I think, I hope that would be a way. Hans-Dieter knows our major, Mr. Palmer. He's very active and he's very, very encouraged and is writing a letter to the Chancellor Merkel. So why does she not use more rapid tests?
Ellos tienen un alcalde que es muy activo en el tema del COVID y buscando soluciones también para la gente y para los test rápidos y para que de esta manera poder mejorar la vida diaria de la gente.
Yeah, and to merit maybe one impulse, animals remembering if this hurts too much, then you can do maybe a warming bath or a warming shower to get a little surrogate, you know?
Warm.
A warm shower or warm
Traduce tú.
bathing.
Dice que para suplir la falta de abrazos y eso, si pensamientos positivos o algo así no es suficiente, una posibilidad es, por ejemplo, tomarse un baño caliente.
Not the same. Let me tell you, I miss the hugs.
Yes, okay, yeah. Yes, it's a different warm bath and hugs. Yes, it's
in Germany and the people in general do not give so many hugs and kisses as we do here.
Yes, I know.
More normal not having
everybody
hugs
is hugging and
kisses.
Yes, it's a cultural phenomenon. Absolutely.
Yeah.
In Germany, you give your hand, says hello, nice to meet you, no hug.
Ellos de todas formas no suelen abrazarse y besarse tanto como nosotros.
Yeah.
¿Alguien más tiene preguntas? Ali, Cecilia. Ali, pon tu micro. Uy, espera, no se te escucha.
Bueno.
Otra vez, Ali.
Ali, estás con el micro apagado.
Ahora sí.
Yes.
Sí, okay. Horst, thank you very much for your presentation. I have to say some words about the rapid test. I'm a clinical doctor. I am a GP, and we work every day with rapid tests. So there is a concern about rapid tests that everybody should be aware of. To use the rapid test, you have to be invasive because you have to put the stick in one nose hole. So it is not that everybody can do it. There is a risk that people do it wrong and make some injuries. That is one point. And second point is rapid tests reflect your situation only in the first 4 to 5 days of infection. In a time where we have a lot of asymptomatic patients, you might cross to a person who is on day 6 or 7, still very infectious. The rapid test is negative, and you expose yourself to this person hugging or kissing, and 2 days later you are infected. So very careful and very concerned about using rapid tests in non-clinical and non-medical educated systems. That is one thing that we have to be aware of, because if not, you might get into a risk of getting infected with not being intentional, but that can happen. We use it every day, and when we see that the infection is more than 4 to 5 days, we don't use that. We use the PCR because the rapid test is negative and the PCR is positive and you are infected. That is something. So the best way is waiting until you get vaccinated, and then you can get close and hug and whatever. That is the shit.
Thank you.
Ali, ¿lo puedes decir también en español, por favor?
Ali, espera. Traduce.
Yo lo traduzco, no pasa nada. A ver, el punto es lo siguiente. Un test rápido refleja el estado inmunológico solo en los primeros 4 a 5 días de la infección. Es decir, si alguien está infectado y está el día 6 o 7, se hace un test rápido y sale negativo, aunque la persona sí es contagioso. Y otra cosa, usar un test rápido tampoco se puede cualquiera, porque hay que saber cómo usarlo. Es un método invasivo porque hay que entrar por una fosa nasal. Y si uno no sabe cómo hacerlo, se puede hacer daño dentro de la nariz, incluso hacer daño al tejido superior que vaya a ser el tejido cerebral. Por lo cual, cuidado de usar test rápido en la calle o en manera no médico, y cuidado que solo refleja el estado inmunológico de una persona infectada en los primeros 4 a 5 días. Nosotros yo soy médico de familia, si alguien no lo sabe, y nosotros lo usamos solo en los primeros 4 o 5 días de una posible infección. Si es más tarde, mandamos a PCR, porque en este caso el test rápido sale negativo y el PCR es positivo y la persona sigue siendo contagioso. Entonces hay que mejor esperar que todo el mundo esté vacunado y ahí sí podemos volver a darnos abrazos. Pero mientras hay que tener cuidado. Horst, the question for you is the following. Strategies to get through the day-to-day of being isolated. I mean, you have brought us a little bit of self-hypnosis and things like that. But strategies of people who are being separated. Many of us have relatives that we cannot see because they are in other countries, and we don't have any expectation to see them in the next months even. From your perspective of psychologist, even for me as a medical person who suffers being separated of family, any strategies, any methods to deal with that kind of forcing isolation?
I think what we do here, Zoom is one option. The second best, third best solution. The issue is self-hypnosis, focus on yourself, and the problem is being with yourself all the time. This is the issue. But
it's not easy.
Yeah. But my experience is, if you have a little deeper relaxation, then you get into another level of consciousness that is of help. Huh? But the question is very
Ha preguntado a Alice si hay alguna sugerencia para lidiar con el problema que tenemos muchos, que tenemos familia fuera y hace meses que no los vemos y la perspectiva de verlos es tan poco buena y es posible que no los podamos ver en todavía muchos meses más, y eso, si hay alguna cosa que se podría hacer desde el punto de vista psicológico.
Yeah, and I think if somebody is experienced with hypnosis, is it possible to create a inner living of being with other persons? But it's not a exercise from 5 minutes. You need 20 minutes, you need 25 minutes, you need 30 minutes. But I did therapies and coachings with persons lying in a clinic that were not able to go outside. They were fixed on your bed for weeks, not COVID, before COVID. And they said it was so helpful being in my fantasy in California or some places where I want to be. It's the best, the second best, but I think it's one solution. But it's you need more time. That's what we did here. We have here 3 or 5 minutes, but I think it's possible, and this is the good message. But I see your question is a very intelligent question.
Lo que dice es, con esto de no poder ver a los parientes, que era una de las preguntas, una de las posibilidades es hacer, digamos, como una automeditación o fantasía de que uno está con ellos. Horst ha atendido pacientes previo al COVID que estaban enfermos y en el tratamiento lo que lograba era que pudieran estar, aunque sea mentalmente, con ellos durante un rato. Y esto les ha servido mucho.
Yeah.
Any other questions?
Un amigo imaginario.
I had a question.
Yes.
I had a question for the rapid test. The German health minister has provided that all Germans have the possibility to make the test every day, and the land is paying that.
Yes.
You believe these tests are beautiful for German behavior? I will give an example. You are calling me. You are saying to me, Hans, you can go with your wife in a restaurant with my family. We are talking, etc. Don't believe that many people, this sad boy, not have confidence for my life. He will que hace un paso para que me recibe. Yo tengo un ejemplo. En Rotary desde hace 20 años hemos tenido, we have a man who was very careful with the hands for bacteria.
Yes.
And when he is eating, before he is eating, siempre has touched with his hand.
Yes.
And one time, a friend is coming when he is eating and has given the hand. It is, you have given me a hand, and now I have to go cleaning my hands.
Yes.
But I'm don't sure that you not have bacteria in the hand.
Yes.
And the friendship was open.
Yes, I believe. I believe.
And thank you when all people disappear before coming you to my house, you have to make the test.
Yes.
What is the result of the social life in Germany?
Yes, it's a good question.
The
Yes.
result, I believe, not is good for the social living.
Yes.
Dice Hans que en realidad en lo de es difícil ir a un restaurante o saludar a alguien porque no sabes al final si el otro puede tener o no tener la bacteria. Y contaba el caso de alguien del club, que no sé quién es, que se lavaba las manos antes de comer siempre, y alguien le dio la mano y después no quiso saludarlo nunca más porque pensó que le había puesto bacterias. Eso previo al COVID.
Yeah, yeah.
Yo no.
My opinion, Hans, is I think it would be good for social life. I think it would be good. This is my opinion, and we have since December experiences here in Tübingen. And I know a lot of person who did the rapid test. We know, as Ali said, the rapid test is not perfect. It's not perfect. But a lot of person were able to visit their parents, their grandparents on Christmas. We have in Tübingen around, I think, 2,000 or 3,000 rapid tests 5 days before Christmas. And we have no super spreading, and we have in Tübingen now around incidents of 30. So I understand the fear behind the test is not perfect. One event could be too much, but we have in Tübingen, I think, the experience that it works up to now.
Dice que el test rápido, por lo menos en Tübingen, ha funcionado, por lo menos para Navidad. Antes de Navidad se hicieron, creo que dijo 5.000 test, y así pudieron estar las familias juntas sin haber tenido corona, un incremento del corona después. Creo que fue algo así.
Yeah, and my personal opinion as psychologist, Hans-Dieter, is maybe it's easy for me to say with 46, but I think life is life has some risks. I think life has some risk. We cannot avoid any risk. It's not possible. If I drive with my car here, it could be that I have an accident that kills me. I think life is some sort of risk, and
dice que la vida es un riesgo y siempre tiene algún nivel de riesgo. Puede aparcar el coche en la puerta y luego tener un accidente.
Eso es así.
Sí.
Yo
sí.
Quiero dar las gracias al Dr. Horst. Thank you very much, Dr. Horst.
Pleasure for me.
Voy a dejar la reunión, I leave the meeting. But first I say that quería decir que cada uno elige la forma en cómo gestionar esto, ¿no? Each person have a method to drive this situation, ¿no? I first look for true information, no information governmental, true information, without anesthesia, true information. And me permito, I have days, me permito mis días malos y mis días buenos, porque también los tengo y me los acepto.
He had good days and bad days.
Yes,
and he accepts himself the good and the bad.
And for some nights that at 4 a.m. I stand up because I cannot sleep. Los días que no puedo dormir a las 4 de la mañana, I use the technique of Dr. Silva, mental control.
Yes, great.
Yes.
Great. I like it.
Very,
Yes.
very good.
Like it.
Abdominal respiration. La
Yes, I
respiración
like
de los
it.
bebés. La respiración que hacen
Great.
los es
That's
buenísimo, buenísimo. A mí me da resultado. To me, it's very good.
Yes, I like Silver Mind. It's great. It's
Yes.
mental technique.
Yes, and it's very important. Es muy importante to have close the items of the past. Es muy importante tener cerrado todos los temas del pasado. Entonces uno está más tranquilo.
It's very important to close everything
Yes.
that was
Yes.
is behind in our lives.
Yes, thank you,
For you,
Ricardo.
one is-
Thank you for this.
I leave the party, the meeting, and thank you to, gracias al Rotary Club de Benahavís, a Daniela, Graciela, los dejo. Y saludos a todos, Hans, a todos.
Gracias, Ricardo, por estar.
Ricardo.
Bye bye.
Hans, Horst, I think we are going to finish now because many people had other meetings. That's why they are leaving. They have been leaving
Yes.
for the last time. We really thank you very much. I will send you the recording
Yes.
as I have it.
Thank you so much.
Herzlichen
so
Dank,
much.
Horst. Das war ganz toll.
Schön.
Und,
Happy. Thank you.
And-
Thank you everybody for sharing your time with me. And I'm very blessed and thank you.
And Daniela, gracias por la traducción.
he hecho lo que he
Gracias.
podido.
Daniela, gracias. Muchas
No sé
gracias.
si ha servido, pero bueno.
Muchas gracias.
El que lo intenta
Eso-
no es obligado a hacer más.
Hasta la vista.
Sí.
Hasta el
Hasta
jueves
luego.
que viene.
Es un placer
Adiós.
que
Gracias.
en el sombre va a venir una estrella y da un poco de conocimiento de la ciencia universitaria. Muchas gracias.
Gracias,
Gracias.
gracias, gracias, gracias.
Gracias a
Hasta la
todos.
vista.
Gracias.